A very good evening to you, esteemed viewer. We are delighted, especially the fact that you are watching Church of Uganda Family TV this particular evening. We welcome you back from News at 8, and of course, here we are with our Tuesday edition of the Family Hour. Adrian Austin Mukalazi is my name. Today, we are talking about oral health and the role of oral health in general health. It is very important that we pay attention to this discussion because it's really important. You realize that some time back on this very platform, we say that poor oral health can also kill your esteem. So it's really important that you pay attention to this discussion, and by the time we leave this place, you'll have learned quite a lot, probably. Some of this information is not commonly out there, and also remember there are a lot of myths out there. Someone will give you a concoction, and they tell you it cures ulcers, diabetes, but also it works on tooth decay, and so you ask yourself, where is the relationship between all this? Now, here we are to get the right information. With us is Dr. Kasangaki Arabat from Uganda Christian University, but also working with Mengo Hospital. It's a pleasure having you this evening.
Thank you. Thank you.
Good evening.
Good evening. How are you, Edwin?
Fine, Doctor.
Yes.
We thank the Lord who has protected us up to this day.
Did you know, Edwin, that many times people think oral health is just health teeth?
Yeah.
However, it is not only health teeth. Oral health is much more than health teeth. Oral health, and when you look at the oral health oral tissues, the tissues, many people take these tissues for granted. And when you look at the oral cavity, not only are you looking at the teeth, you are looking at the gums, you are looking at the teeth, and everything, plus the face itself.
Oh, so it is that detailed?
Yes. And when you look at that, you will find that it is these tissues which facilitate us to smile, to speak the way we are communicating one with the other, to build our self-esteem, like to be able to laugh without any control, to eat, to love, to smile. And at the end of the day, we take these functions for granted. However, it all starts with how healthy our oral tissues are.
Wow, this is interesting, and that is a very good preamble. Now, before we get into the details now, so you've given us what the viewer should expect to learn this evening. So you have all reasons to stay tuned in Church of Uganda Family TV. I kind of greet the people.
Good evening, viewers. It is nice to be with you this evening as we learn and we look at the oral health together.
Now, following the preamble you've given us, we now want to look at, you've given us a brief on oral health, so we know what is in the oral cavity. Now we want to see the relationship between oral health and general health, because that is what we are looking at, the role of oral health in general health.
Let's look at it this way, Edwin.
Yes.
You cannot have good health with poor oral health. The two go hand in hand. When you look at oral health in different perspectives, it is related. The cavity or the oral cavity is a gateway to the general health. It is a gateway to the whole body. Sometimes in the oral cavity or in the mouth, to use the common man's language, you can see a mirror of which organ could be not well in your body. Sometimes you may find when someone has a bad liver, you could find the lining of the mouth turning yellow. That is a sign or a symptom that something else somewhere is not healthy. Or when you look at the gums which we have in our mouth, someone might be having diabetes. However, because of poor gums in our mouth, you will find that the unhealthy gums could complicate the disease that you have, which is diabetes, and bring into complications. Many times you will find some people, they start losing sight when they have diabetes, or maybe they don't know they have diabetes. It begins with, I can't see well. They get glasses, but they haven't been to see the dentist to see how does the gum look like. And because you have gum disease, you may have complications to the other diseases that you have. Or you take, for instance, someone with poor gum health, which could complicate and then go into endocarditis. In other words, you have the covering of the heart or the housing of the heart getting infected as a result of having poor health in the mouth.
How is that related? Because someone would really say the effect is in the mouth. How does it reach the heart? Or what is the science there?
You see, when you look at our parts of our bodies are interrelated in that you have the mouth which is sick, or part of the mouth which is sick, but because it is sick, under normal circumstances, me and you have bacteria in the mouth. We have these animals which are living within our bodies and within our mouth. But the moment you have a disbalance, that disbalance could be reflected somewhere else. Blood, which goes throughout the body, you have the same blood which is supplied to different parts of the body. That could be the source or the carrier of the infection that you may be having in your mouth to go and reach your heart. I don't know whether it makes sense to you.
Yes, it does.
Thank you. So, the moment you don't keep your gums okay, you may have problems. The moment you have a bad tooth and it remains untreated, you may have a problem. We can tell you more about this because, we are looking at today being the beginning of a series of what we shall be having with you.
Yes.
We need to open up. And we need our viewers to remain tuned with what comes in every other week, with what we shall come in with. Because, look at it. You may look at a mother who is expectant. But the moment this mother who is expectant, studies have shown where you have gum disease, chances are you may have a baby with low birth weight, or you may have a mother delivering prematurely because we did not take care of what is in the mouth. So there are interrelationships.
Wow. So you will realize that it's really very, very important that we keep our oral health. Now, talking about oral health, what are some of the specific systematic health issues that can arise from poor oral health?
Systematic health issues. We can look at, there is what we talk of as the oral manifestations of systematic diseases, or the diseases that are in the body. You get a reflection when you are in the mouth. Or maybe, to answer your question, poor oral health, let's say someone had a cavity or a hole in a tooth, to use the common man's language. That hole progresses into involving the pulp, which is the heart of the tooth. And when the pulp or the heart of the tooth is involved, you have infection beneath the root of that tooth. That infection could easily go into the bloodstream, starting with creating a cavity of infection, which could be an abscess, And if the abscess remains untreated, you could have that abscess growing. It could affect other tissues. Looking at the body, it has layers. The infection could go through the layers to go into the chest, and eventually you could have complications which sometimes lead to death. But it has started with a tooth.
Wow. Now, let us look at some of the indicators that you have issues, that show that you have issues with your oral health.
Indicators that you have issues with your oral health and maybe general health.
Yes, general health.
Some of them, some people will have pain. Some people will come with bad breath. Some people, they brush in the morning, they start bleeding. Some people, they will tell you, I can't eat cold stuff, I can't eat hot stuff. In other words, you have associations, you have pain, which is characteristic. And when you go to a professional, he might tell you, we've seen clients who come in, they come in complaining of pain. You may have pain whose origin might be the tooth. You may have pain whose origin is from elsewhere. Sometimes you go to a facility, or a patient will go to a facility and say, I have pain. I've had 3 sleepless nights, take out the tooth. And yet the tooth is healthy. But because our body, the parts or the structures of our body are interrelated, someone may come with sinus issues and they are complaining of a tooth on the upper jaw. And to look at it, the tooth is okay. However, the problem is there. Or someone might come when they've had issues, piling one issue above the other, one issue above the other. They have what we would call psychogenic origin, and they have pain. But you see, because we are the professionals, when you go to a professional, they will listen to you. They will tell you where the problem is and how best to manage the problem.
Okay. When you were talking about, I think my bad breath was so specific to me because we've had very many people tell people, no, a bad breath might not necessarily be about brushing, but the gas in the tummy that comes out through the mouth. Doctor, shed some light on this so that someone can see the connectivity between the abdominal gas and the breath that is in the mouth. The bad breath.
See, when you have bad breath, the first person to approach is the professional who deals with the mouth. They may look at the mouth. One of the things they may find, do you have what we call calliculus or stones around the teeth, or what Waganda may call kabole. I brush, I spit blood. However, the bad breath could arise because the mouth is not clean. It could arise because the tonsils have issues. It could arise because your lungs have issues. It could arise because your liver or the gut has issues. So it is only what I would call by ruling out. When the dentist sees this is not there, then you look elsewhere. Otherwise, the first person to reach out to would be the dentist. And when your dentist tells you so, you can, of course, look for the other possibilities. And sometimes bad breath can be psychogenic. In other words, in your mind, you think about it when every part of your body is healthy, but around you, you feel, my breath is not good.
Okay.
Yes.
So, looking at oral health still, what do people then need to do first of all, to prevent, because we believe in prevention is better than cure. What do they need to do to prevent, how to eliminate some of those issues that arise due to poor oral health?
There are two things what you could do. To some of you viewers, some of you have insurances, and some of you may not have insurance. Reach out to your dentist at least once a year, better twice a year, to have checkup. When you have issues, they will be identified early and dealt with early. However, naturally, or because of our culture, we seek care when we feel pain.
Exactly.
Don't wait until you feel pain. When you go for checkups, or when you come to us for checkups, we'll be able to identify your challenges and we sort them out. That would be the best advice. And that would lead maybe all of us to have healthy smiles and healthy mouth. Two, some of you have families. Maybe to you it hasn't been a culture, but you can start it with your child. The moment you see the first tooth in the child's mouth, take them to see the dentist. The dentist will guide you on how to keep that baby's mouth healthy. The dentist will help you to understand what foods to eat and when to eat. They are part of the care team. Very important.
Okay. Talking about foods, are there any foods associated with poor oral health? For example, we've had information out there, we don't know how true it is, that don't eat this, and don't eat this because it's not good for your teeth, it's not good for your oral health, it's not good for your tissues. So are there any foods associated to maybe tooth diseases or oral diseases?
You see, there is a saying, too much of anything
is always bad.
Is always bad. Refined sugars are a killer with regard to the teeth. And then two, whatever food you eat, it would be prudent to brush after every meal. However, sometimes we can't manage. So we recommend at least twice a day, after breakfast and before you go to bed.
Why after breakfast?
Why after breakfast?
No, and not before breakfast, because the routine is always our routine. the wananchi, you wake up, you brush, and then you have your breakfast.
First and foremost, we need to understand why we brush. We brush because we need to deny the microorganisms the food that remains in the mouth. So if you've had your breakfast, but because of the way you have to go to work, you don't have space where to brush from, you can brush before breakfast. However, better after breakfast. And if you can't, then rinse, so that the mouth is void of the food that you've eaten, so that the bacteria will have less to work on to have an imbalance within the mouth. Why? The food we eat, or the carbohydrates, after eating, when they remain in the mouth, the bacteria that we have in the mouth will break down that food to create the acid, which acid destroys your teeth. And whatever remains, sometimes you have a slimy lining on your teeth, which with time, with the salts that we have in our saliva, will together form a hard substance around the teeth to bring the gums to start receding, or to bring what we will call caliculus. And hence, when we don't keep our mouth clean and that substance develops, that's when you begin seeing, I'm brushing, I'm spitting blood. And in the elderly who live up country, because they don't have access to oral health care, you find the teeth are moving out of position. And they come and tell you, my son, the other day my tooth chipped off, but it is the substance which has broken, and they beat on it. It is as hard as stone. And at night you need to brush, having eaten as the last thing before you go to bed. Why? Because when you brush, you keep your mouth void of the food that you've eaten, so that the bacteria will not have enough to digest, to produce the byproduct, which is not good for your mouth.
Okay. The other concern is, for how long should I brush? How should I brush? Which toothpaste should I use while brushing? Because we also don't rule out the fact that some people have been told to use things like charcoal, ash, but also especially in villages, some people don't even use toothbrushes. They use sticks. So that is also another very big concern.
Regarding brushing, as you've rightly said, I will use the poor man who lives deep in the village.
Yes.
Whichever village you look at, but deep in the village. Or let me use the islands, which are hard to reach areas, where access to dentifrices or the toothpaste, the toothbrushes, where you have limited access or inadequate access, we can use whatever we have around us. And what we have around us, they might be the branches of trees that you are talking about. What are we doing? Mechanically, we are removing the food debris that remained after our eating. In other words, we are cleaning our teeth. The most important is to maintain the mouth clean. But where access is possible, then we recommend to use fluoride-containing toothpaste.
Why fluoride?
Why fluoride? Fluoride is an ingredient in the tooth structure, in the enamel, which, just in case you have the mineral imbalance, it will enhance remineralization of the teeth. In other words, it maintains the balance to maintain the tooth not being destroyed. So you need the fluoride.
Okay. That is, what about the concoctions that people give? Use this, there are also very many mouthwash substances on market. Some have been told to use charcoal, pound it very well and use the powder. Others have been told to use ash. What is all this science?
There is no science in using ash or charcoal. Why? Charcoal or the ash that you are using is highly abrasive. What does that mean? The charcoal and ash will encourage, or some people use salt, it will encourage the wear of the tooth. In other words, when you use charcoal or you use ash or you use salt, which is in solid form, you are increasing the wear of the top surface of the tooth. Eventually, when you use these substances, you may find yourself tomorrow feeling your teeth are very sensitive because whatever you did was detrimental.
Does a mouthwash replace toothpaste?
No.
Then what role does it do?
Mouthwash, it may contain some ingredients. It improves on, it reduces on the amount of the bacteria at any given moment when you wash your mouth, because some of the mouthwashes, they have some chemicals which have been added, some of which are either bactericidal or they encourage the cleaning. They encourage the cleaning and reducing on the levels of bacteria that are in the mouth at any given time.
Okay.
Yes.
Now, I think this is very clear. Well, at this point, we are taking a short commercial break. When we return, we are continuing with the talk. Therefore, stick with us as we come back. Most importantly, we need to talk about the lifestyle as well. So we are coming back with a lot more. Therefore, come back with us.